Levodopa. Only a small portion of total drug reaches the brain. Nausea may be offset by domperidone. Levodopa may trigger hallucination. Risk factors of stroke, sickle cell disease, cigarette smoking, atrial fibrillation. Myasthenia gravis symptoms worsen towards the end of the day. There may be difficulty in chewing and swallowing. Penicillamine may precipitate similar illness. Test for functional assessment of encephalopathy. Flapping tremors, number connection test, constructional apraxia. Blood components in clinical practice, transfusion associated GVHD can be prevented by prior irradiation of transfused blood. Oral direct thrombin inhibitor, dabigatran. Correct with regard to metformin, the maximum tolerated dose is 2000 mg per day. Lactic acidosis is the major adverse effect of metformin. Metformin lowers the blood level of vitamin B12. Correct regarding short stature, linear bone growth rates are pituitary dependent. Final height in boys can be estimated by adding 6.5 cm to mid-parental height. Replacement therapy with recombinant GH restores growth velocity in GH deficient children. Sitagliptin least likely to cause hypoglycemia. Differential diagnosis of hypocalcemia, hypomagnesemia, chronic alcoholism, pseudo-hypoparathyroidism. Treatment of hirsutism, estrogen, finasteride, spironolactone. Glargine, long-acting insulin. A 15-year girl present to the hospital with severe abdominal pain, vomiting and cold extremities. She has tachycardia, hypotension. Lab investigations show blood glucose 400 mg per deciliter, blood pH 6.9, urine ketones triple plus, serum creatinine 1.4 mg per deciliter. She was promptly administered with IV fluids and insulin. After 4 hours, she complains of inability to lift her limbs. What is the next management? Potassium repletion. Composition of oral rehydration solution WHO: sodium 90 mmol per liter, potassium 20 mmol per liter, chloride 80 mmol per liter, energy 54 kilocalorie per liter. Correct regarding tuberculous meningitis, acid-fast bacilli are infrequently seen on direct smear of CSF. CSF culture for MTB is the gold standard for diagnosis. Expert MTB RIF assay is a preferred initial diagnostic option. Subcutaneous preparation useful for treatment of osteoporosis, denosumab. Osteoporosis, it does not cause symptoms until a fracture occurs. Vertebral fractures can prevent with loss of height and absence of pain. It sometimes presents incidentally as a radiological osteopenia. Ankylosing spondylitis. Bamboo spine may be seen. Uveitis is the most common extra-articular feature. It is more common in males. Carpal tunnel syndrome associated with pain and tingling in hands at night, weakness of thumb abduction, loss of sensation over lateral half of the palm. Which of the following can be used to monitor disease activity in rheumatoid arthritis? Pain, visual analog scale, DAS28 score, ESR. HIV-associated infection least likely with CD4 count greater than 100 cells per millimeter cube, cerebral toxoplasmosis. Test for graphesthesia stereognosis are used clinically to assess cortical sensation. A blast victim is brought to the emergency. Victim is unconscious. BP is 80 by 50 mmHg. Pulse is 110 per minute. Ready and SpO2 is 70%. Victim has rapidly swallow breathing and signs of external blood loss are present. JVP is raised. Heart sounds are absent on auscultation. The next single most immediate step in management after securing airway and breathing and circulation, urgent pericardiocentesis. A 21-year young female was brought to emergency department with history of unknown substance ingestion. She was having vomiting, perfuse diarrhea, bronchochoria, excessive sweating. On examination, meiosis and muscular fasciculation are present. What is the most likely diagnosis? Organophosphorus poisoning. A young female of 22-year-old presented to medical emergency with complaints of nausea, vomiting, abdominal pain, diarrhea, convulsions, along with methemoglobinemia. Diagnosis: copper sulfate poisoning. Which of the following are components of SOFA sequential organ failure assessment? Serum bilirubin, platelet count, serum creatinine. Birdshurt's retinopathy associated with acute pancreatitis. In a healthy young adult, what proportion of sleep time is compromised? Rapid eye movement, REM sleep, 20 to 25%. Which of the following drugs can cause idiopathic intracranial hypertension? Tetracycline, retinoid, vitamin A. As per the Gale and Combos classification, farmer's lung is which type of hypersensitivity disease? Type 3 hypersensitivity. Hormonal regulation of salt and water balance in a nephron occurs at collecting duct. Which of the following parameters suggest of pre-renal azotemia, haline cast in urine sediment? Most common cause of chronic kidney disease CKD is diabetic nephropathy. Which of the following statements regarding contrast-induced nephrotoxicity are correct? Diabetes mellitus is a risk factor. Hydration is necessary. Omit metformin if nephrotoxicity occurs. Which component of autoregulation of glomerular filtration acts on the efferent arteriole? Angiotensin II mediated vasoconstriction. Which of the following are consequences of nephrotic syndrome? Increased lipoprotein synthesis, low serum globulin levels, increased serum aldosterone levels. Sickle cell syndromes are caused by a mutation in beta globulin gene. In sixth amino acid, glutamic acid is replaced by valine. Which of the following high reticulocyte production index is seen? Sickle cell disease, glucose 6-phosphate dehydrogenase deficiency, blood loss. Combination of drugs can be used for treatment of relapsed myeloma. Lenalidomide, bortezomib, dexamethasone.